so how do I use these handling guides that I found? So based on the bar and the label that you would receive from the pharmacy and, referencing that hazardous drug list that is available to you, you would determine if the medication is group 1 or group 2. Then you would follow the guide. If the medication is a group 2 pink hazardous drug, like I said before, only those who are pregnant, breastfeeding, or actively trying to conceive would take extra precautions and wear PPE. Anyone else would just take universal precautions. So you'll also get a copy of this, but this is the handling guide that is out there on bin. So basically you would just follow this. It'll say, what you're doing with it, what type of dosage form it is, and then tell you whether it's bedside preparation or administration, what you would wear, how you would handle it, and then it's got the group 2 pink over on the other side. So where do you get the PPE that you need to wear? So you have these hazardous gowns. They're stocked in your supply room. So Materials stocks these in your supply room. The gloves, you have the gloves in your med rooms and all of the patient rooms. So you're just going to use the universal gloves, but these are chemo rated. And the way you know that they're chemo rated is on the back. It's got a chart here where it says chemotherapy drug permeation resistant tested per ASTM D6978, and it tells you what all it's been tested against. But that's kind of like the national standard for saying that gloves are chemo rated. So you can wear any of your gloves. You're just going to double glove when you are administering a hazardous medication. So how will the medication get to you? How will it be dispensed? So like I said, oral hazardous medications might even come from the Omnicell, and you'll just follow the handling guide for the correct dosage form, whether it's a tablet or a capsule or an oral liquid. IV and IM dosage forms will be sterilely compounded in the pharmacy clean room using a closed system transfer device called EquiShield. So this is an EquiShield syringe. They have these extra pieces on the end of it. So EquiShield is known for these 3 red lines, and that's how we're going to teach you to attach them. So they'll come down, IV push and IM doses will be dispensed in that EquiShield syringe. It will be capped and come down to you like this. IV infusions will be dispensed with a primary tubing attached to the line, and that tubing will have already been primed with the saline or whatever fluid that it's in. And then an EquiShield piece called an FC1 will be lure locked onto the end of that line. So you'll have those pieces would come down to you from the pharmacy. Then in your med room, you actually have another piece called the LL2. LL stands for Lure Lock Adapter, and you also have some extra one of these FC1s. So you have those in your med room, and those also are stocked by Materials. So now you're probably wondering, how do I put these together and how do I actually connect it to the patient and administer the drug? So again, you'll have those LL2 pieces stocked in your med room as well as extra FC1s. If you're giving it the IM route, again, it's going to come down in this syringe, and then you are going to take the LL2 piece. Again, LL2 is lure lock. You're going to get an IM needle, and you are going to lure lock that onto a needle, 23 gauge, 25 gauge, 1-inch needle, whatever you would use to administer an IM injection. Once that's lure locked onto the needle, EquiShield is known for red to red. So you are going to snap the red to red together, and you'll hear that click, and that's actually engaged the syringe. EquiShield is closed system transfer because unless these pieces are connected, you cannot pull back or push on this syringe. So it will not allow anything to escape if it's not attached. So you're going to have that attached, and you're going to have your IM needle attached, and you're just going to administer it like any other IM route injection. Should we stop?